Okay, hi everybody. Thank you so much for joining us. It's right at 12 o'clock, so we're going to go ahead and get started with our webinar today. My name is Emily Lakemaker, and I'm the Associate Director of Recruitment and Student Life here at the Rollins School of Public Health. And we are so happy that you could join us today for our Health Policy and Management webinar. Just a few logistics here up at the top. We are recording this, so you can go back and watch it as you like. We usually have this posted to our YouTube channel within 3 to 5 business days of the live event, and I'll be emailing everybody that's registered for this the link for that when that's available. So feel free to, if you don't catch anything today or you want to go back and re-listen to anything, you'll have the opportunity to do that, or to share it with any friends that you think might be interested in our HPM department here at Rollins. Additionally, you can see up in the upper right-hand corner where my cursor is, there should be a section up there that you see that's titled Questions. Please put your questions in for us. You can do that throughout the webinar. What we're going to be doing is going through the actual PowerPoint presentation itself, and then going back and reading the questions aloud and allowing our staff, faculty, and current students the opportunity to answer those questions for you guys. And so with that, I think we'll go ahead and turn it over for introductions with everybody that's on the panel today, and then we'll get started with the webinar.
Hi everyone, my name is Sarah Blake. I'm the director of the MPH and the MSPH programs here in the Department of Health Policy and Management.
Hello, I'm Kathy Wollensing, and I'm the academic advisor for the program.
Greetings everyone, my name is Lauren Taylor. I'm a second year student on the policy track at HPM.
Hello everyone, my name is Garrett South, and I'm also a second year student but on the management track.
Wonderful. This is Dr. Blake. I am going to bring us through a majority of the slides that you have in the presentation today. And as Emily mentioned, after we present sort of the information for you about the Department of Health Policy and Management and our programs, we will spend some time answering your questions. So please feel free at any point to type in the questions. We are joined by students as well, and as we always say, they are truly the experts, and we welcome any questions that you have specifically for them. So as I mentioned, I'm the director of the master's programs, and I've actually been here at Emory for almost 16 years. So I have a really good understanding of course, how the department works, but also I've been also working as a health services researcher for those years as well. So I'm going to talk to you first about our department, and one of the things we really want you to understand well is that the field of health policy and management is very interdisciplinary, and our department reflects that. We have a faculty that reflects experts in so many different related fields in economics, sociology, political science, public policy, health services research. We have faculty who are physicians and psychiatrists. And as a result of the interdisciplinary nature of HPM, our curriculum is also very diverse. And our interdisciplinary approach, it can be seen both in the content of our classes, but also we feel that this interdisciplinary nature gives students a really comprehensive background in health policy and healthcare management. So the skills you will see are reflected in our curriculum really reflect both conceptual and analytic knowledge related to the fields of health policy and management. And those really focus on improving the health status and delivery of health care in the United States.
There we go.
So I want to first talk about the differences. As you may or may not know, we offer 2 different programs in our department. The first program we want to talk a little bit about is our Masters of Public Health program. This Masters of Public Health MPH program includes 42 credit hours. As an MPH student, you can choose a 2-year track for policy or management, or you can choose a 12-month accelerated management track. Either the policy or the management track can be a 2-year program. If you're a health policy student, you do only have that option. With the MPH program, all of the students, whatever track you choose, are required to complete a capstone, which is essentially a practicum, an opportunity for you to work in the field of health policy and management. And that capstone requirement is a culminating experience that you will have for your program. We also have a practicum that I'll talk about in a few minutes. Our MSPH program is a Master's of Science in Public Health. That program requires 48 credit hours to complete. It also requires a thesis, an individual and independent research program and thesis paper. That is a smaller program. We generally accept between 7 and 10 students, and there are some differences in the curriculum which we can talk about. But you do, as an MSPH student, also are required to do a practicum. Okay. So let me talk now about the practicum. Our HPM Practicum, again, all students in whatever track you choose, MPH or MSPH, or of course Health Policy or Management, are required to complete a practicum. This practicum applies knowledge and skills acquired through the coursework in a community-based environment. An ideal practicum should relate to your academic as well as your professional interests. And our practicum is really shaped so that you are included well-defined competencies and learning objectives, and that you can process and track and evaluate student performance and competency achievement and practical experiences. The HPM Practicum requires a primary supervision by a qualified field supervisor, and that is one in which is someone on site at your job that will agree to sort of supervise your work. It can be a practitioner, someone that essentially evaluates your performance as an intern or practicum student while you are doing your practicum. Another great strength about our practicum is that it includes a potential opportunity in a variety of agencies and organizations that you may not otherwise have access to. We really emphasize your ability to have that experience in whatever discipline or whatever environment or setting that you feel is appropriate to your interests and also professional goals. So as an example, we've included local and state public health agencies. Some people work at the CDC for their practicum, but the opportunities are really quite broad. They've even included international non-governmental agencies and organizations. Another thing I just want to mention, as you can see on the slide, that it's important for you to understand is that there is a minimum requirement of 200 hours to complete your practicum over the course of your program here. You can work more than 200 hours, and I would say that most students do work more than 200 hours, and select a practicum in different settings. So you can do 2 practicum, one that may be 150 hours, maybe another that's 50. So you don't have to focus just on one setting for your practicum. Also just important for you to note is that all students are assigned a practicum advisor, so you're not left on your own to figure out how to get your practicum. We make sure that you have enough resources here to choose the right practicum and to get information about how to make those choices.
Hello everyone, this is Kathy. I'm the academic advisor for HPM, and now the slides that we'll go over is in detail to show you exactly what the curriculum entails. So if you do, the first slide that we're looking at here is the policy track, and as Sarah mentioned earlier, it's a 2-year program, and the good thing is when students are accepted into the program, you're eligible for the MPH to be in policy, management, and the 12-month accelerated. If you have an interest of the MSPH, you would want to let us know so that you would be reviewed by our admissions committee in order to have the opportunity to pursue that. A lot of students come in and they're undecided if they want policy or management, so please note that the first semester all students, whether policy or management or the accelerated 12-month program, will take the exact same coursework in their fall semester. And then when you pre-register for spring, which would be in late October, at that time you would need to declare your track, whether you're policy or management or the accelerated. And I would follow up with you in detail on that. And then the program, as Sarah mentioned earlier, is 42 credit hours. You can see what's offered in fall, then the spring. Everything that's pink on the slides are required HPM classes. All of the blue marked classes are core, like you take an undergraduate. And then you have freedom of electives to choose electives in HPM. You may choose electives across Rollins as well as law school, business school will provide additional electives where students can complement their areas of interest. So that's the policy track. And now here on this slide, it's a slide that shows you exactly what you would do for, again, the 2-year management track. Your first semester is the same, and then it would break off into the management curriculum, and you do have the 2 capstones that you would complete, one in the fall, the strategic management, and one in the spring, which is operations management. Again, the freedom of electives to choose here as well. And here is an outline of our 12-month accelerated program. A lot of students say, what are the pros and cons of doing the 12-month? So the 12-month, we usually have a cohort of 10 to 12 students that choose this track. Students, when you're doing this, it is the exact same cost as the 4-semester program. You just take tuition and divide it over 3 semesters instead of 4. Now, the one thing you have to be aware of doing the 12-month accelerated is you are in classes in the summer, so it doesn't open up for you to do a practicum in another city or even abroad. So you would be here in Atlanta, but it's totally doable, and it could a little bit eliminate how many electives you can take, because we're on flat tuition, so your tuition you're allowed to take, like we have recommended in this 12-month program, 17 credit hours. Well, for you to add on additional electives, sometimes that can stretch you a little too thin if you're wanting to work hours as well. And here is an outline of our MSPH program that Sarah mentioned earlier. This is our research track program. Again, this one is 48 credit hours as opposed to 42, and a thesis is the end result. Only MSPH students can take the classes listed here.
Great. So this is, we just wanted to provide some more information from our current HPM students who are here on the panel with us. As you see here, this is Lauren Taylor, and I'll let you talk with a little bit more in depth with them. Lauren is a graduating MPH candidate. She's also worked in the CDC for her practicums. She's been very involved in student activities. And she will certainly talk with you about that. And then Garrett also will be graduating, yay, this May, on policy and management, and is a student council member, has been working in student leadership, and also very involved in several groups here at Emory. So maybe we can speak just a few minutes and have you guys talk a little bit about yourselves and anything else you feel is important for the audience to know about being a student here.
Okay, I'll start. So as Dr. Blake said, my name is Lauren Taylor. I'm a second year in the policy track. I guess I can just talk about a little bit about why I came to Emory. Is that fine? I'm from Jacksonville, Florida. I went to the University of Florida. Go Gators, chomp chomp. Emory was always just the #1 school I wanted to go to. I tell people this story all the time about how it was the only school I actually applied to, which is probably sounds really weird to most people because I think people cast a wide net. But I knew right from the get-go Emory was the school I wanted to go to. I love the fact that when you come here, when you come to Atlanta, you know that it's essentially a mecca for public health because you have the CDC here, you have CARE, you have the American Cancer Society, and there's just so many ways to really plug the skills that you've learned while being at Rollins into the respective areas that you may want to work at one day. So I was fortunate enough to be able to secure a practicum at the CDC, which I guess to backtrack a little bit, I was able to have a Rollins Earn and Learn position, which is essentially kind of like the work-study program that Emory has, and I was able to get my connection to the CDC through that, and then through doing my work in the fall and spring semester, my supervisor was just like, hey, we have extra funding for our ORISE position, would you be interested? And I was like, totally.
Can you give a little bit background as to what ORISE is?
Oh, yeah, so ORISE is a fellowship. It's a fellowship that's really heavy focused in research. So at the end, you have to submit a type of product or deliverable that kind of shows what you went through during your experience through your as an ORISE. But typically, the fellowships can range from 1 year to 5 years. But since it was just the summer, that was the only I was only there for a few months. But I'm actually looking at potentially doing ORISE again after I graduate. So it's a great way to really broaden your experience as far as research and really strengthen those core skills. So yeah. Do you want me to keep?
Okay, thank you. That's great, Lauren. Thank you so much.
So this is Garrett. I am from Los Angeles. I went to school in Boston at Massachusetts College of Pharmacy and Health Sciences. I was a pre-med major, came straight out of undergrad. You'll see from our program that it's very diverse. We have students coming straight out of undergrad, also students coming in with work experience. So don't feel if you're in any of those buckets to not apply to this program. When looking for my graduate program, I really knew that I wanted to make a bigger impact and wanted to make management decisions in healthcare, but I wanted to go the public health route because my passion is for health disparities and urban underserved populations, and I was really able to match those here at Emory because, as you can see, not on the slide, but yes, actually, I'm part of the Social Contextual Determinants of Health certificate, so I'm really able to take classes in those health disparities and then bring it into our core here in HPM and apply it through the lens of administration. And what I really love about Emory is you get as Lauren said, we are in the mecca of public health, and we are at this amazing research university, but you're reminded every time you step foot on campus that you also are in the South with just the warm and supportive community that the staff, faculty, and students that you'll be surrounded here at Rollins are.
That's great. And we will, as I said, spend some time letting you ask any more questions of our students, because again, they're such the experts, and they're really living through this experience as we speak. So feel free to be very candid with any question that you might have for them. We want to turn, often we get these questions even before students enter in our program about what they can expect in terms of employment. So we thought we'd just we have listed here just a few things in terms of the types of positions and settings our students end up getting when they graduate. So just in terms of the MPH alumni, those students tend to have a great variety and types of jobs that they seek and acquire. Some of our students decide that they go into consulting, so those could be groups like PricewaterhouseCoopers, it could be lots of Deloitte and Touche, those kinds of employers who also come here and recruit specifically from our student body. So those are wonderful opportunities if consulting is in your future or an interest. We've also had students who would like to get government experience, and the Government Accountability Office, the GAO, is a wonderful opportunity that many of our students have had, not only with final employment, but also have taken their internships during the summer. So GAO is a wonderful opportunity for you to apply to your research skills and health policy skills in particular, and place them in a federal government setting. We've also had our students place in health insurance, health plans, including Humana and Kaiser Permanente. Also the Department of Health and Human Services, DHHS, which is a government agency primarily in Washington, D.C. that administers and funds many healthcare programs. Students have also sought positions in that agency. And then here, even in Emory Healthcare Clinic, many of our students, Garrett, I think you had an internship, correct, at the Emory Healthcare Clinic, but if you're interested in healthcare management, there are a number of our alumni that take positions here at Emory Healthcare. Our MS-PH students, I would say 60% of them go on to advanced research policy jobs, and maybe about 40% tend to then go on and get their PhD. For our students who have used their advanced analytic skills in the job market, they've tended to get jobs at different consulting groups. Here is listed as Centers for Medicare and Medicaid Services, CMS. We've had students take senior data analyst jobs there. We've had students take jobs at the Georgia Health Policy Center as senior data analysts, research analysts, also at Emory Healthcare. And then we've had a number of students, these are just two recent students who have gone on to a PhD programs. University of Minnesota, Brown University, and our most current student actually was accepted last fall at Harvard. So we've been able to really place our MSPH students who are interested in a PhD program at very well-known, very Ivy League even schools. So there's a great breadth of employment opportunities for all of our students. As you heard Garrett mention, and as he is part of, there are a number of opportunities for you to really focus or specialize your studies in the MPH program or MSPH program. This is just a list of the different certificate programs. We welcome and encourage you to look online to get more information about each of those. I specifically teach classes included in the Certificate in Maternal and Child Health. Yes, Lauren is part of that. I forgot to mention, very important, and I encourage her to talk a little bit about her experience. It is quite a great honor to be in that certificate program in particular because it is very competitive. I think they only take 20 students. And so that is, I think, the only one in which you need to apply and indicate your interest at the time of application. It's changed a little bit, and there is a little bit more of a competitive process. However, all of these programs are very popular, are very good. The one that Garrett mentioned, the socio-contextual determinants of health, is probably the most popular. A lot of students who are interested in health disparities work can really focus their studies then on those specific topics. And we do have faculty that also teach in the Certificate in Mental Health. Our own Dr. Ben Dress actually leads that particular certificate program. I think we've talked your ears off, but we're certainly here to, of course, answer any questions. These are the contact information for both Kathy and myself. And we do want to mention before we open up the lines that we have Visit Emory for those students who have been accepted and are interested in coming to learn about Emory and meet us in person. We'd love to see you. March 30th and 31st. It's a great time for you to come. You can sit in on classes, get to know other students, ask them what life is like here. And then, of course, on the 31st, you will actually get to meet faculty in our department. So we hope to see you, and we welcome your questions.
And just as an extra information about Visit Emory, we do offer travel grants for that. You can reach out to me directly, Emily Lakemaker. That's emily.lakemaker@emory.edu. Feel free to reach out to me directly to inquire about our travel grants because we want to make sure that cost isn't a barrier to you being able to attend this event. That's how important we feel that it really is for you to be able to come. Okay, so what we're going to do now is we're going to start reading the questions from students that are in the webinar. There's a handful, but it looks like from students that left. So let's start. Let's see. Is there a thesis requirement for the MPH program?
No, there's not a thesis requirement for the MPH. There is a thesis requirement for the MSPH students.
Okay, and so Zena is asking, are the practicum, is practicum paid?
Practicum, for the most part, is paid. We encourage you strongly to take a paid position. Have there been practicum opportunities where our students have decided to take an unpaid practicum? Yes. But you, as I mentioned again, you will be assigned a practicum advisor, and that advisor should help you really select your practicum and give you good guidance. They do not find you your practicum, but they give you good guidance about which organizations, what kind of setting is most appropriate. And I would say, you know, for the most part, practicum are paid, but Lauren wants to also give you her insight.
Yeah, just like Dr. Blake said, most of them are paid, but we strongly encourage you to start looking for your practicums early because a lot of times those paid practicums will get snatched up by people. So try to start your search as soon as possible, but you'll definitely have a lot of support for you to search for them.
Both Lauren and I were paid.
Yeah, they were both paid. Yeah. So.
And also, Career Services has a listing called Handshake, and so our Career Services Department is very good in assisting with what opportunities are here at Rollins and even outside companies that are posted. And then we provide you a list of where students have gone from the past, and so you can do anything from where a student has gone previously, or select something new if it may be from your hometown or a city that you would like to visit over the summer and have an opportunity that is welcome as well.
All right, Zena's asking, do graduates from your health policy program find their knowledge applicable in other country health systems, for example, a healthcare system in Africa?
Well, I will tell you as an example, one of our most recent MSPH graduates just took a job in China, at a university in China as a senior research assistant. So, and this was a student who also did her practicum overseas. So while, most of the curriculum really focus on U.S. domestic health policy, there are a number of opportunities to learn about healthcare and health systems internationally and globally. And one of our professors, Dr. Saltman, teaches a comparative health systems class. Lauren is nodding because I think it's a very popular course. As we have become a more and more global community, certainly Emory is a very globally focused. It makes complete sense that students in our department would also have interests internationally. So we welcome that and encourage you to look at opportunities overseas.
Let's see. Cindy is asking, Cindy's got a couple of questions here. First up, could you give some information about what the resume of an entering student would look like? It's pretty varied, I would say.
Yeah. I mean, even as Garrett said, some students are coming right from undergrad. Those, I would say more and more of those are students who are, 5 or 10 years ago, we didn't have students who had undergrad degrees in public health. You obviously had some exposure, Garrett, in public health before you came to Rollins. We have a number of students, it's probably 50-50, that have had 1 or 2 years working, and working in different settings. It doesn't have to be in health policy. But, as I didn't know anything about health policy until I, really got to school. Was working completely in a different field. So I think it really is varied.
Yeah, just to add a little bit to that, I actually didn't have explicit experience in health policy. I actually did a stint in AmeriCorps for a year. So I was placed in my hometown, Jacksonville, Florida, and I was actually able to do a lot of community education regarding domestic violence and bullying in schools. So I guess that definitely speaks to the fact that there's a wide array of experiences that come into this department, and I think that just makes it even more great because you're actually able to feed off those experiences and apply them and to just use them to advance you forward and bring different perspectives. So it's great.
Yeah, and our class size is about 98 students per year that we bring in, and it usually ends up about a 50-50 split between policy and management, as well as we bring in a strong cohort of international students. So as Lauren mentioned, the discussion in the class is very broad, and you get that international perspective, as well as we have a lot of dual degree options. So we'll have med students, we'll have PA students, business school, law, so it really does help with the discussion in class.
All right, and then Cindy's second question is, what type of advisors are available in the program?
Great question. So as a new student, your first semester, you are assigned, based on what you've indicated, if it's known, of your interests, you are assigned to a faculty member. And you are encouraged at the beginning of your semester in the first year to really get to know that faculty member, to make time to let them know of your interests, whether it's just broad interests in public health, or if you have specific interests, let's say, in research, and you'd like to maybe even be a part of their own work. So you do get assigned an advisor, a faculty advisor, and then, of course, as we've talked about, once you get closer to the time of thinking about your practicum, you have a separate advisor. We really value that faculty-student relationship and encourage everyone to get to know their faculty while they're here. We are very, I have myself hired at least in the past year 2, if not 3 students to help me with my research. I really value, that opportunity to get to know the students and help them and have them help me on my projects.
Yeah, and then I am the academic advisor, so I help you from the time you come into the program until graduation so that you don't miss any requirements needed to complete the degree. So I'll take care of you on that front. And then, so as Sarah mentioned, you'll have an academic advisor. I'm the academic advisor. You'll have a faculty advisor. You'll be assigned a practicum advisor, as well as career services as a resource. And Garrett, you may be able to speak on the big SIB, little SIB, where students can, you all assign that to first year, second years.
So as part of our student government role, we have department representatives, and that role is really to be the liaison between faculty, students, and really just make sure that HPM is having a great experience, student experience. Part of that, as Kathy mentioned, is a big SIB, little SIB program, in which when you are a first year, you will be assigned to a second year. That will, and we do match you with your interest and try to keep you within the same tracks if you already know what you're interested in, just so you can get really some mentorship, and they already have stumbled and then they'll be like, don't take that step, and just teach you on the right ways. Do you want to speak about? You love your little SIBs.
I love my little SIBs. It was actually funny because I think it was during Visit Emory. This one girl who I wanted to be my little SIB after I spoke to her, she had been stalking me kind of on like the ambassador page, and she was just like, Lauren, you're interested in X, Y, and Z. I'm interested in that too. So we had a conversation for about 30 minutes, and as soon as I finished, I was like, Garrett, I need to make this girl my little SIB. So it's great because it really fosters those relationships, and you feel like you're able to pour back and kind of like help someone bridge the gap. So it's great.
Perfect.
Okay, next up is Zena is asking, how easy is it to balance schoolwork and raising a family? So I know the two students in here today can't really speak to that, and Kathy, I think, can take that as the academic advisor of the department.
Yeah, I have several students in our department, as we said, the varied age. I think the average age is 27, 28 for our department, but some of the students are older, some have family, some students are part-time. Even though it's a full-time program, it's not an evening program. But when students choose to have a family, it's always like we have to really watch what they're doing when it comes to balancing everything, because sometimes they'll say, well, I have child care issues. So we're very clear on what the expectations are on the academic side, but our goal here sometimes is, it's always to make the student be successful. So I may recommend you may want to look at going part-time and making this, or taking a leave of absence for a semester. But most students that are have families, most of them have new babies, and so they might be out for a semester and then come back and get started, and it has been very successful because you do a lot of projects that are team-based, and our students do work very well together on team-based projects, and so it seems to have worked and been very successful.
Zena is asking, what is the window of opportunity to change programs when school has started?
So if you're coming in HPM, I'm going to assume you're asking the difference between management and policy. And as I stated earlier, you have to do that by when you pre-register in October. Now, if your question is saying, I've come into HPM and I wish to go to EPI, that's a different story. So what we would have to do, you have to then let me know what you're thinking. It's best to get in the right department when you start, because a lot of programs, specifically HPM, is very lockstep in what you need to take in fall to be ready for spring, to be ready for the next fall. And only classes are offered at certain times. And so you'll see this across departments at Rollins. So, but in HPM, you can decide between policy and management all the way up until October. And believe me, Lauren and Garrett can tell you, if you change your mind, that you'll know by the end, because you've put in a couple months already and you know which area you wish to go.
And just as a follow-up, if you have chosen MPH and halfway through your first semester you think you should have accepted or applied for the MSPH program, unfortunately that switch is not cannot happen in the first semester. So you really need to know very clearly up front whether you want an MSPH or an MPH degree. There's really no switching between the two.
Because it's a very quick program, and 2 years of grad school goes by in a flash. And so we try to get you on track as quick as possible and help you choose different electives. So if you have a strong interest in HPM and you choose us, but you want some EPI classes, I'll be like, take your electives in EPI or in global health. So it's a good complement to your degree.
Lily is asking about when students should start their practicum experience.
You can choose your practicum. You can start a practicum technically in the spring semester of your first year. We do not allow you to start your practicum in the fall because we really want you to get settled as a student. You have a bunch of classes to take. We want you to be really successful. But you can start your practicum in the spring of your first year. I would say typically most students don't do their practicum until the summer. But you do have until spring of your final year to complete the minimum of 200 credit hours.
Zane is asking, are first-year students applicable for graduate assistantships, and how are they selected for those? So,
yes, all students are eligible to work, so you'll hear students use TA or the GA, graduate assistants, between the two. So students are eligible to work in your first semester. As Sarah stated, you have to wait till your spring semester to start counting any work in the spring semester as a practicum. And then for a practicum too, let me clarify, you have to be working outside in the field to be a practicum, to be eligible for that. But working as a TA or a graduate assistant, that would be listed on Handshake through Career Services. All opportunities must be posted, and then at that time you apply, and you're welcome to be, if you're an HPM student and you have an interest in another department, you can apply there as well.
and those positions, as admitted students, you guys get access to that job board in very early August, so about 3 weeks before classes start. And what we really like to impress upon you guys is there's no stress or expectation to have something lined up by the time classes start. For some reason, every year students come in freaked out because this job board's been available for 3 weeks and they don't have a job yet, and that is not the expectation by any means. Most of our students are actually securing their on-campus employment once they're here, and they actually get to start speaking with professors and networking. And I know students hate hearing the word networking and hate the idea of doing it, but it really is the truth that that is how you're getting these opportunities. You are meeting your advisor, you're meeting your faculty members, you're meeting people in the school and starting to make those connections and finally getting an idea of like where a good opportunity for you would be. Also keep in mind with our graduate assistantships, teaching assistantships, research assistantships, these are hourly paid positions and they do not include a tuition stipend. I know at a lot of schools that's part of these experiences, and here it is it's a paid position. So just keep that in mind.
Also, just to speak from personal experience, when I found out that I was awarded the real award, when I came in, I didn't have a job. So just to kind of like ease your thought process, like Emily said, don't trip out. It's not that serious. I actually didn't secure a position until the end of, I think, September. But for me, at the CDC, they don't start work until a little bit later in October. So that was perfectly fine, and I was able to transition in. So yeah, don't be too worried about it, but I will advise against not picking up too many outside activities, especially in HPM for your first semester, because it's honestly one of your hardest semesters, and you really want to be focused on your classes. So that's just my word of caution.
Good word, good word. So Ling is asking about the major differences between the healthcare management classes and the health policy classes.
Well, this is Dr. Blake. So health policy courses are, again, geared toward making sure you are strengthening your analytic and, almost research skills. The healthcare management courses and those graphics that we've showed just a few minutes ago will clearly delineate the type of classes. So the management courses are really focused on financing and healthcare management. So it's really looking at the different ways in which the management of healthcare can be addressed, and really the delivery of healthcare. Policy also does examine finance, is certainly a big part of that, but in terms of what skills you are trying to build in the policy curriculum are really analytic and writing skills, and understanding how you use information to build an argument or deliver a health policy proposal. Any other thoughts?
Yeah, just to let you guys know as well, just because you select a specific track doesn't mean that you're isolated to that track only. There's a lot of students who have for instance, in the policy track, they're taking a ton of management classes. I know one specifically, she's taken so many classes in the business school. So don't think that it's an end-all be-all just because you pick a specific track.
And also that applies to your department here. You know, even as an HPM student in the policy track, if you really enjoyed your epidemiology core class and you wanted to use your electives to take some epi classes, you can do that. You're not siloed in your one thing. And like Lauren said, we've got students that take classes at the business school, at the law school, at the nursing school. So once, you know, registration is opened and their students have, you know, registered, then they open up any of those remaining spots to us, and several of our students will take that opportunity.
Just a plug for the management track, because there's all policy in the room. So the management's we emphasize the soft skills, the team approach. Most of your classes, once you do get into the purely management classes, will all be group projects and really understanding how you function in a team and how you can bring that, as Dr. Blake mentioned, to a healthcare delivery system, and making those skills apply over there. You can really, the way management curriculum is, you are competitive against MBA students and MHA students, because in the job that I will be going into next year, an administrative fellowship, I did compete versus those candidates, and then I did get the position. So don't think that an MPH in the management will set you apart from that. You will have this.
And kind of going along lines with the collaboration and the group work, I think that's just one thing that collaborative would be, if I had to pick one word to describe public health, I think that may be the word. And it really, I think the fact that you have to do so much group work and work so closely with everybody in your department helps prep you for that, because when you get out into your job in public health, you're not working in a vacuum. It's not just you sitting in an office making decisions, and you're having to get out and engage with the public and engage with other public health professionals. So it really kind of helps prep you for that and get you ready for that, because it's certainly not a vacuum.
Just to piggyback off of Emily, with the whole collaborative piece, I really feel like that's something that's really strongly identified when you go into certificates, because you're actually, especially for the MCH certificate, I'm with people who are from EPI backgrounds, people who are from BC backgrounds, a lot of global health. So it really forces you to be in situations where you have to use your skills that you've gained from your independent departments, but to work together to solve common problems and issues. So,
yeah, awesome. All right, and then Lily's asking, for international students, what is the percentage of them that find jobs in the U.S. after graduation? I know I don't have that data.
I don't have the percentage, but I'm going to be up front. It's a challenge, because you have to be sponsored by a company to get your visa. And so Career Service has one designated counselor that helps international students. Her name is Sam, that will help students and be aware of who you're applying to, where the barriers are. So it is a challenge for international students. There's a lot of practicum opportunities, so that's not the issue, but it comes down to when you become to be hired full-time, that some of those barriers are a company has to invest in you. It's an additional cost to hire an international student. So there are some things that come up that is very clear, and Career Services works closely with international students so that everyone has the same opportunities. We have some students that have stayed here. We have some students who wish to go on to pursue another degree, or they return back to their home country.
And also Career Services, Sam, the counselor that's assigned to the international students, they do a seminar or a panel each year, usually in the fall semester, specifically with international alumni that are still in the States, and bring them back to talk about how they secured their positions and the challenges they face. So we do really try to provide you the international students with the specific guidance that is unique to your needs. It's not to say that we can guarantee you anything by any means, but kind of going back to the list of resources and advisors that are available, it's also not a matter of just saying, we'll figure it out on your own. We do what we can to help give you those resources and make those decisions. So that seems to be it on the questions. Does anybody else have anything before we wrap it up?
feel free to reach out to us. I think one person just posted.
Oh, we've got one more question right here. Cindy's asking, can you speak to the diversity of the faculty? Yeah, absolutely.
Sure. So as I mentioned, in terms of diversity, there's certainly diversity in our disciplines and our approaches to public health. We have a number of faculty that are health economists. We have diversity in their professions, doctors, public policy analysts, diversity in terms of gender. If that you're interested, we have about 4 or 5.
Full-time faculty.
Yeah, full-time faculty. Other diversity, I will say that we've currently just hired 2 new female faculty members. They will be joining us in the fall, and that'll be very exciting to have them join our faculty. They are also very interdisciplinary in their fields. Overall, we have 17 teaching faculty, and that includes the faculty that are here in the department. We also have a number of faculty that are considered adjuncts that work with us mainly as health management faculty. And one of the things that's really important, and we feel is important for those faculty that's helpful for our students, is that these are faculty members who are working in the field. And I think, Garrett, you probably would also agree that with healthcare management in particular, having someone that's working in health management in the field and bringing their expertise to the classroom is essential and really provides an important perspective for our students, and I think oftentimes provides a nice collaboration for students who may want to have experience working in the fields of healthcare management.
Absolutely.
And also, Cindy, on Wednesday of this week, gosh, was it only Wednesday? We did our Students of Color Perspective webinar where we had a panel of 5 or 6 current students that gave their perspective of their experience here, why they opted to come here, their experience with faculty, and that is on our YouTube channel. That is posted up there right now. If you just Google RSPH admissions YouTube, it should pop right up, and it should be one of the more recent videos, because I think I just posted that this week. And Lauren's got some stuff to add as well.
Sorry.
She's been raising her hand desperately.
Sorry, I just wanted to make this point, just to kind of deviate from the diversity on the faculty piece, to talk more about the student piece. There are tons and tons of student organizations that really allow you to find your niche if you're looking for something specific. I actually was on the exec board for the Association of Black Public Health Students. Our main vision was to really advance issues related to health in communities of color, but it definitely was not an organization that we kind of just blocked out like anyone who wasn't a student of color. So it's very inclusive. We also have a committee that's really focused on diversity and inclusion at Rollins, and we're really trying to work to push that envelope forward. So just know that if you come to Rollins, there's many opportunities for you to get plugged in to whatever area that you may need in order to fit those diverse needs.
And there are 2 faculty members in HPM that are on that diversity committee, including myself. So we really value the ideas of diversity both in the student population and faculty as well.
And I had something else Lauren jogged something in my head and now it's completely out. But I was going to add in terms of student groups. So we've got ABPHS, which is Association of Black Public Health Students, and then several other identity-based groups here. QTC, which is the Queer Trans Collaborative. We've got a new one that just got chartered like last month, which is the Rollins Latinx Alliance. So that's a new one that's just getting started and led by some first years that are really eager and excited. We have Jewish public health students. We have RASA, which is South Asia public health students, Rollins Association of South Asia Students. I know that we've got 19 or 20 or so chartered student organizations within Rollins, and that's just Rollins. But then you're also eligible to join any of the other organizations at Emory. It's not, delineated, but we have a lot in-house. So we have a very active student life, which I think actually sets us apart from a lot of other schools of public health and graduate school programs in general. It's very easy to get involved, and we do a lot on the staff end to help promote that.
Great question.
Okay, so that wraps up all of our questions. It looks like everything else was just you guys saying thanks. And we say thank you very much to you guys for joining us and watching this today. Like I said, we have recorded this and it'll be up on our YouTube channel within a few days. I have to do like some converting of this to get it up onto the YouTube. It's of course never that easy of just posting. So look for that here. And again, like I mentioned, on our YouTube channel, we've got our Students of Color Perspective webinar that's already up, as well as our financial aid one is up there as well. And then this coming Wednesday is our LGBT Life webinar at Rollins. And so that we'll be joined by some current students as well as staff from Emory's Office of LGBT Life. So join us for that one. So if you have any questions, you've got the contact information for Dr. Blake and Kathy up here on the screen. And we would certainly feel free to reach out to us. We're happy to help answer any of your questions. Thanks for joining us and have a wonderful weekend.